Schizophrenia is a complex mental disorder that profoundly affects how individuals perceive reality, influencing their thoughts, emotions, and behavior. Imagine trying to tune into a radio station, but constantly getting interference. Distinguishing reality from distortion can become incredibly challenging. It affects around 24 million people globally, translating roughly to about 1 in every 300 individuals. So while it's relatively uncommon, it's far from rare. Typically, schizophrenia emerges during adolescence or early adulthood, usually between late teens and early 30s, making it particularly impactful during crucial developmental years. Genetics play a substantial role in schizophrenia, with hereditary factors significantly increasing one's risk. For instance, if an identical twin has schizophrenia, there's roughly a 40 to 50% chance that the other twin will also develop it. However, genes alone don't determine everything. Environmental factors such as chronic stress, prenatal complications, early life trauma, or substance abuse, particularly cannabis use during adolescence, can heighten the risk of developing schizophrenia. Interestingly, some evolutionary psychologists propose theories suggesting schizophrenia might persist in human populations because some genes associated with it also contribute positively to creativity and abstract thinking, qualities that historically may have been evolutionarily advantageous. The prevalence of schizophrenia globally is about 1%, meaning it affects around 24 million individuals worldwide. It's a condition that crosses all boundaries of culture, class, and geography, although studies indicate it can be somewhat less severe in communities with stronger social support systems. This highlights the critical role community and social connectedness play in managing mental health disorders. Schizophrenia symptoms can be categorized broadly into three types: positive, negative, and cognitive. Positive symptoms include hallucinations, such as hearing voices or seeing things that aren't real, and delusions, firmly held false beliefs resistant to rational explanations. Negative symptoms refer to diminished emotional expression or lack of motivation, making daily functioning and social interaction challenging. Cognitive symptoms involve issues with attention, memory, and executive functions, significantly impacting an individual's ability to organize, plan, and process information effectively. When it comes to treatment, antipsychotic medications are typically the first-line intervention. These medications primarily address symptoms by regulating neurotransmitters like dopamine, which is thought to play a significant role in schizophrenia. However, they're not without side effects, such as sedation, weight gain, or movement disorders. Psychosocial interventions, particularly cognitive behavioral therapy, CBT, family therapy, and social skills training, complement medication by helping individuals manage daily life and integrate more effectively into society. Exciting advancements in schizophrenia treatment include drugs like CAR-XT, which target different neural receptors and might provide symptom relief with fewer side effects than traditional antipsychotics. Here's a fun fact. Despite common misconceptions, schizophrenia doesn't equate to multiple personalities. That's a different condition known as dissociative identity disorder. The term schizophrenia actually originates from the Greek words schizo, meaning split, and phren, meaning mind, referring to fragmented thinking rather than the split personalities. Additionally, historical misconceptions have long associated schizophrenia with violence. Yet individuals with schizophrenia are statistically more likely to be victims than perpetrators of violence. Interestingly, famous mathematician John Nash, depicted in the movie A Beautiful Mind, successfully managed schizophrenia and went on to win a Nobel Prize, demonstrating how effective treatment and support can enable remarkable achievements despite the illness. Another intriguing fact is that symptoms of schizophrenia can differ significantly depending on culture. Patients in developing nations sometimes experience less severe symptoms, possibly due to more integrated community structures that provide emotional support. Furthermore, there's an intriguing link between schizophrenia and attention deficit hyperactivity disorder, ADHD. Approximately 25% of individuals with schizophrenia experience significant attention issues or ADHD-like symptoms, complicating diagnosis and treatment strategies. It's like your brain attempting to juggle multiple conversations at once. Clarity becomes a serious challenge. necessitating comprehensive treatment approaches that address multiple symptoms simultaneously. While challenges remain, increased understanding, empathy, and innovative treatments offer hope and improved quality of life for those affected.